Hello, good evening, and welcome to Become a Better Man. My name is Tunde Disu. Thank you for being part of today's program. It's going to be another encounter in the health awareness program that we've been running for. This is our third week of looking at health as a topic of conversation. So it's going to be great. And today we have a great guest in our midst. We have with us today on this program somebody that you want to hear from, somebody you want to listen to, because she's a professional, she's an expert, she's a consultant in her own in this field of in the area that we'll be talking about tonight. And when I did the promo this afternoon, I was talking about. I made reference to the program that used to come up on the TV called "This Is Your Life," and I'm using that as an analogy to say this is your health. This is your health, because you remember the first week we looked at health awareness as a whole package on its own. Then last week we had a guest on the program talking about mental health and on all that relates to that. Thank you for all those who were with us on that day, those who shared, and all the contributions that you made. So in that same vein, we are going to be looking at another aspect of our health today. Another aspect of our health, which really I think it's very, very important, because it's an area that a lot of us take for granted. We just really have it, and we don't think about it. Which is good if you don't think about it, because the moment you start thinking about an aspect of your body or a part of your body, then it means there's an issue with that part. But to avoid you having an issue, we have on the program tonight somebody who is going to tell us a lot about our eyes. So tonight's program is titled Health Awareness, Sight and Vision. Sight and Vision. Your vision tells you, or your vision rather, says a lot about the standard of life, the quality of life that you live, and how you are enjoying that life. I know what I'm talking about, because sometimes, even if I just leave my glasses to read my phone is an issue. I have to quickly find where's my glasses and put it back on. So if you are in a position where you don't have that as an issue, congratulations. But that is why we have our guest on the program today. But before we bring on the guest, I'll quickly say a few things about the topic and then hand it over to the professional so that she can take us through. And please, if you have questions, if there is a particular thing you want to know, or there's something that has been bothering you, that has been a concern for you, especially in the area of sight and vision with your eyes, or your contact lens, or your glasses, or your laser surgery, or you're thinking of any of them, feel free to drop your questions as we go on, so that our guests can attend to it. It is not what you look at that matters, ladies and gentlemen. It is not what you look at that matters. It is what you see. Because it is what you see that will register on the inside of you. And so when it comes to what you see, we're talking about your sight and your ability to see, your sight and your vision, because these are very important aspects of our lives, because they allow us to connect with the world around us and our environment. They help to keep us safe and maintain a good mindset in everything that we do. The world we live in is filled with shapes, colors, sizes, ups, down, and all of that. It is the ability to see. It is the gift of sight and the gift of vision that work together and help us bring meaning into the things that are around us, into the things that affect us. I've seen videos of people who are color blinded, and to them everything is just one color, whatever the color is. And then, thank God for technology with these new glasses that they give to them now, and will allow them see colors. You will see a grown-up person seeing red for the first time, seeing green for the first time. They will break down and cry. Do you know why? Because for the first time, they understand, they come to the realization of what they've been missing out on. But you and I see all these things and we know what color is this, but we don't think about it. However, there's a difference between sight and vision, even though they work together hand in hand. Sight is more physical, while vision is more metaphysical. What do I mean by that? Sight is a sensory experience in which light reflects off of a shape, of an object, of a color. It goes into our eyes. The eyes then send that to the brain then converts that to an image. It is at that point that vision picks it up and gives meaning to the image that the brain has converted that information to. So you can see it's like sight is the input. The brain will then do its work on turning it, changing it, focusing, and all of that. And then your vision will give understanding to what the image has become. So when you understand that, you can see that the relationship, the coordination between your sight and your vision, even though we can't see where the demarcation line is per se, but they're there. The difference is there. Sight may allow you to witness an event, for instance, but it is your vision that will help you understand the significance of what you have just seen, of what you have just witnessed, of what you have just perceived. Sight gives us the ability to perceive movement, but vision gives us the ability to make assessment, to make to give us an understanding of what that movement is about. Sight and vision are important. They are very important because they bring beauty. They bring beauty and understanding to the world around us. I remember reading an article years and years ago, and they were asking Stevie Wonder. They said, what is the one thing that you would like to do? If you can have your eyesight for 1 minute, what is it you would like to see? And he said he just wants to see the face of his wife. Now, to you and I, we don't even think about it. But to somebody like him, who is in that position, you can see how meaningful, how tangible, how important is this ability to see, this ability to convert image and give it, to have an understanding from an image that we're looking at. 9 out of 10 people, in a survey that was done, 9 out of 10 people agree that it's very important for us to take care of our eyes. Oh, it is absolutely important that we look after our eyes, we protect it, we preserve it, and all of that. Funny enough, 4 out of those 9 said they have never been to an optician to have their eyes checked. They recognize it is important. They admit that it is very crucial, but they have not done it. They themselves that are confirming that this is important, they haven't done it. Unfortunately, many of us don't know how important our eyes are, but more than that, how crucial it is for us to take time to examine our eyes, to visit our opticians, to go down the high street and sit in their funny chair and look into their funny whatever it's called. But at the end of the day, just like any other aspect of our health, until you go and check it, you don't know what is going on. You don't understand how far damaged, if any, it is. I remember when in the first week of this month, when I gave the example about my wife, we were just walking down the road and she said, oh, I've not checked my eyes in a long time. Let's go in and see it. We went in, and lo and behold, unbeknown to us, my wife was about 85%. She had about 85% detachment in her retina. And we didn't know that. If we never went in by chance that day, who knows where we'll be today. So you may be walking around thinking all is well, but until you take the time to go in and check, you may never know. So, having done my intro, it is time for me to bring in our guest. It is time for me to introduce to you our special guest for tonight. And let me bring her on. Yes, Dr. Wadi is our guest tonight. While she's joining us, let me tell you briefly about Dr. Wadi. Dr. Wadi is a very good friend of mine. We've been friends for some years now. We attend the same church, and there she is. The doctor is in the house.
Good
Hello,
evening.
Doctor. How are you, ma'am?
Very good, sir. Good evening.
You're very welcome. I was just
Good to
about to
see you.
introduce you, so let me do that, and then you can fill in the blank spaces as we go along. Dr.
Okay.
Chibuzo Wadi, well, as the name clearly tells us, she's originally from Nigeria. She's a doctor of optometry she's a doctor of optometry. Is that right?
Correct.
Good. Currently, she's the CEO and optometry consultant for Vision Care Logistics Group Limited. She was formerly, that group used to be called, was it called Specsavers or something like
I
that?
was I
Anyway,
was a director of Specsavers.
you were a director of Specsavers Optician in Devon. Dr. Uwadi is a fellow of the American Academy of Optometry. She's a member of the College of Optometry. I'll get it right, don't worry. Member of the College of Optometry. She's also a member of the British Contact Lens Association and also Association of Optometrists in the UK. She's a fellow of the American Academy of Optometry. She's also a politician. Can you believe that? She is also a politician because she's a councillor in the North Ward of Canterbury Parish Council. Ladies and gentlemen, I present to you Dr. Chibuzo Wadi. Doctor, thank you so much for being part of today's program. We
Thank
appreciate
you.
you. You are very welcome.
Thank you,
I will
sir.
roll it over to you now to take us through what do you want to tell us tonight about these Korokoro eyes?
About your eyes.
Yes, ma'am.
Yes, good evening, everyone. I'm going to really keep it very simple. It's not a clinical meeting, so I will keep it as simple as possible. And we started off, I was listening about vision, about eyes. And there's something I always say that the eyes are the windows to the rest of the body. The eyes are the windows to the rest of the body, which means that if you can't see, then the rest
The whole
you
of your
probably
body
don't
is
know
in
what
the
else to do.
wow.
And if you can't see properly, there are different ways of seeing properly. It's not just looking, because we do get patients come into the practice and they say, I can see for miles.
Wow.
And then when we start testing their eyes, we realize with our test kit and test expectations, they can't see the expected standards. And if you do live in the UK, for instance, there are visual standards for you to drive in the UK.
Okay.
Even in different countries, even though they might not be specified, there are different expected standards for driving, for moving machineries, for even watching television. There are expected visual standards. But the eye is just like any organ of the body which grows throughout life. I'm going to start from the very beginning, from when you're born. There's
Oh.
expected level that you're meant to see as a child. I'm not going to give you technical jargons, but those expected levels make it possible for your young born child to be able to respond to certain expected standards of vision as a baby.
Okay.
And if we test those ones, because there are different classes of optometrists, of house visitors, health visitors who do the assessment.
Yeah.
And if they do the assessment and your child does not meet that standard, we will need to take them to what is called an orthoptist. Orthoptists are the ones that look after muscles of the eyes. Now you'll be wondering how would how would a child see? We have special tests for babies for them to see
Okay.
clearly, for them to respond. So from the age of few weeks, few months, to maybe let's go up quickly to age of 3
Yeah.
or 4, we start doing sight tests. So some people say, no, my child don't need glasses. But I mean, being as fresh as today's test, I was testing a child who was only 3 years old. And at the age of 3, she couldn't see more than 2 lines on the chart.
Wow.
And the chart we used to test. So if a child of 3 cannot recognize basic pictures, on the Snellen chart or all sorts of charts we use, that's a problem.
Yeah.
That's one thing. Number 2, if your child, for instance, is born and is cross-eyed, coming from Africa, we hear people saying 4 o'clock eyes, right? When they're squints, we
Yes.
call them squints. So when your child has a squint, it only means the power for the eyes to focus properly isn't present. So that makes the eye either go in or go out.
All right.
So if your child has a squint and you just think, and I don't intend to make it a religious whatever, but you intend to take the child to church for deliverance, you're going to make that child lose their sight.
Wait, doctor.
And I'll say it again.
Just a minute,
If your
doctor.
child has a squint, if your child's eye looks that way or that way, and you don't bring them to see an optometrist or a health visitor or an ophthalmologist early enough, the child might become permanently damaged in terms of the vision. So one of the things, if you notice such thing as a parent, that your child is not responding very well, watching television and sticking too close to television, I think the best thing is to get it assessed. We might end up giving glasses because sometimes we test their eyes and they get certain prescriptions, most likely plus lenses. And that will help them because a lot of kids suffer in school because of uncorrected refractive errors. Now that's jargon, right? Refractive error means the need to have the right status for your vision. So if this child has no correction, and correction here means either glasses, I wouldn't, for instance, prescribe contact lens on a baby. There are specialists who do that. But within my limitation of practice, I would probably recommend glasses after conducting or performing certain tests. So this is the basic structure from childhood. So don't say, oh, no, it's a child, don't need glasses. So when the child, we miss that test from the age of 3 or 4, chances are that after the age of 8, we might not be able to correct much because the eyes have taken shape. So we do always suggest that try to bring your child before the age of 8. Things can be done afterwards, but maybe that's a standard age that we in the UK do suggest. They do other tests in the hospitals.
Yeah.
Now, as you progress in life, you ask yourself, how does the eye really work? How does it work? I don't have a sketch here, but I can just try and sketch something that looks like the eye. Okay? Can you see that?
Yeah.
That little area there, I'm just going to use it as a little sketch.
Yeah.
So there about where you have the cornea of the eye, just somewhere there.
Yeah.
Then you have the lens. Then you have what they call the aqueous humor.
Yeah.
You have the vitreous humor.
Yeah.
And you have the retina. You have the choroid, and you have the optic nerve itself. The sclera, the choroid, the retina, the optic nerve, And on the retina itself is what is called the fovea centralis, which is where every image focuses onto the retina.
I see.
This is just a sketch. Now, we get light coming from infinity. Infinity is anything from 6 meters, which is our standard testing expectation. When you test somebody's eyes and you give the person a chart to read, we expect you to see at 6 meters. We expect you to drive within 612, 6'9", 6'10" to be safe to drive. Okay. Now, if I test your eye and you do not meet those standards, there are two things or three, a few things that would have happened. The light is coming, which is white light, hits your cornea. The cornea provides 90% of vision and crosses into the aqueous humor, contributing, refraction onto the lens capsule, to the vitreous chamber, onto the fovea centralis, transmitting it to the optic nerve, to the brain. It's just the simplest way the eyes work. Now, this is when all things are equal.
Okay.
But guess what? Everything is never equal.
There's always an issue somewhere.
Everything is never equal. The light is always white, perfect. But the cornea could have a scar, an injury on it. So that compromises your 90% that you're expecting. There could be other things on your iris. The iris is the colored part of your eyes that could compromise the ability to see. There could be cells on your aqueous chamber or the narrowing of the aqueous chamber. I will come to those because there are certain diseases that cause narrowing. And then there could be a hardening of the lens capsule, which I will talk about again. So if there's any depression or compromise of any of the structures, you will not have the perfect vision.
Wait, doctor. Doctor.
Yes, sir.
Wait. Because you're saying this ball here.
Yes, sir.
There are chambers that everything goes through. And if any of those chambers or any of those elements has a defect or has an issue, it affects the ability to see.
Correct.
In all of your getting, get understanding. Wow.
Yes, sir.
Okay, go ahead.
So that will bring me now to what we call your refractive status. Okay. Just like you have your health status. Now, the state of the eye being healthy or unhealthy is what's your refractive status? So your refractive status, you're either what they call emmetrope or hyperope or myopes or astigmates or a combination of both or all four. An emmetrope, simply put, is perfect. Emmetrope is EMMETROPIC. An emmetrope is somebody who has round football eye.
Like mine.
Simple. Round football eye, which means on all the four 90 degrees, 180 degrees, all that is perfect. They are equal on every meridian. Wow. So when somebody comes to see me and I test the eye and they didn't miss anything on my chart and there was no error at all, that's an emmetrope, which means that's a perfect eye. There are probably not many people who are emmetrope. There are, but not many.
Okay.
And then the next phase is somebody who is a myope. And sometimes we get asked, am I short-sighted? Am I long-sighted? Am I that? A myope means short-sightedness. And I'm going to keep it very simple. Again, I'm going to sketch. Now, this is again this little sketch of human eye again.
Yeah.
A standard human eye contains your cornea, your lens, your optic nerve, and the rest of it. But images coming from far want to focus, and they want to focus on the retina, which is just there.
Yeah.
And if it focuses exactly on the retina plate, which is the photographic plate, then you got perfect eye. But for a myope, it focuses inside, just within the box, within.
It won't get to the retina.
No, shorter than the retina.
Okay.
So when it is shorter than the retina, you are short-sighted. Okay? Which means when you look at images, they appear smaller, blurrier,
Okay.
difficult to see, and in some cases, they squint their eyes in order to narrow the palpebral aperture, which is the aperture between your lids, in order to focus properly and see. This person will need glasses if it is within certain strengths. Sometimes minus 0.50, minus 0.25, depending on the patient's complaint, and will prescribe glasses to make them see better. And when you make them see better, the images start focusing again on the retina. So when you test the person, they say, oh, I can see now, because you've corrected it.
Okay.
I could easily be tempted to lay hands on the person and say, be healed. No. But I will just put the glasses. But I must say though, if I give you glasses and you take the glasses off, you'll be blurred again. So it's not a permanent treatment. For as long as you put the glasses on, it corrects the error. You take it off, the error is removed. Now, this classification I'm talking about is now single vision for people under the age of 40.
Oh, okay now.
I'm going to break it down. It's very complicated, but let's keep it simple. So
yes,
I'm dealing
please,
with
go
people
ahead.
below 40. People between the age of 4 months or 5 years or whatever to the age of 29, 30, 40, short-sighted, no astigmatic components. This is a correction I give them.
Okay.
The next one is hyperopes. They are long-sighted. This is the same
image,
cornea, optic nerve, retina, but the image is forming outside the retina.
Of the retina. I see.
Long-sighted. So this is a long-sighted person. The image is longer than the retina. I'm trying to keep it simple here. There are more technical ways to describe it.
No, please, you're doing well. Please.
So this person is not every long-sighted person that will need glasses.
Okay.
So I'm going to correct this person from child. So a child is born with at least +1 or +3 even, and then as they grow, they change and drop down. But if you have a child who tells you, I cannot see the board in school, I cannot write properly, don't assume they're short-sighted. They could be long-sighted. And most children are long-sighted.
Really?
Most. So when kids complain so much, we tend to correct them. And for children, we'll do what they call cycloplegic refraction. Big words. Simply means putting eye drops to allow the eyes to open up, and we can know what is hidden long-sightedness, which we can't just correct by just doing flip-flops of the test.
Okay.
I hope I'm not too fast.
No, you're doing great. This is learning point for all of us. Please, guys, if you have any question, please just type it in. We've got the doctor in the house.
And then this is myopic, emmetropic, hyperopic. The next one is astigmatism.
Okay.
You hear people talking about astigma. Some patients call it astigma and all that. It simply is rugby-shaped eyeball. So I'm going to draw rugby now. So the astigmatic eye is unequal powers in different meridians.
Okay.
So you've got the 90 degrees and the 180 degrees, but they are unequal. So the focusing point is you might have it in or out. Say a double in, out. If the person is short-sighted, you have minus here and minus there. Long, short-sighted, and then very close, short-sighted, double short-sighted.
Wow.
And they are not touching the retina. I won't go into the complication of it. But anyway, the focusing of that means you have to correct on 2 meridians. And if you're long-sighted, we'll correct on 2 meridians as well. So that's what we call rugby-shaped eyeballs. Now, whether you're short-sighted, long-sighted, or astigmatic, we need glasses to correct. Now, that is about glasses for under 40s.
Wow. This is
So what if I get to the age of 40, for instance? What if I get to the age of 39 or 40? I will come back to kids because there are some children that do wear bifocals. And you notice you cannot read small prints. And you start doing this.
Stretch your arm. My friend said,
stretch your hands.
When you get to the end
stretch
of
your hands, you do that,
back.
you increase the light, and it's not working. Guess what? You won't need laying on of hands, trust me. You need glasses.
Okay.
You're going to need glasses to help you see small print. Now, that stage is called presbyopia. Presbyopia. And that simply means old age eyes.
Thank you.
As much as it sounds like that, but most people who are over 40s struggle with reading. So we need to correct. If you're long-sighted and or short-sighted, we need to correct that first. Then we correct the reading as well. You don't do it by going to the shops and buying £1 glasses, which most people do. Because sometimes £1 glasses can help you, but there are some others that £1 glasses do not help. Yeah? Now, this is all about glasses. It sounds simple. But do you remember I said in the beginning, for you to have perfect vision, a lot of factors need to be in place.
Okay.
Healthy eye structure, healthy cornea, healthy lens structure, healthy retina, and healthy vitreous. But what if some of these things are not healthy? That brings to play certain common diseases. I'm going to mention a few. Glaucoma. This is one of the complicated eye diseases, but it's a major cause of blindness, especially among blacks.
Sorry, say that again.
Glaucoma is one of the top causes of blindness, especially among blacks.
Wow.
I'm emphasizing on blacks because I know we have glaucoma patients who are Caucasians and Asians. But among blacks, because we are one of the people that never visit until lastminute.com. But if you have a mother who suffers from glaucoma, a father who suffers from glaucoma, a brother who suffers from glaucoma, or a sister or a child who's got glaucoma, you are at risk of blindness. I'm not mincing words.
Doctor,
so we need to, yes, sir.
Can you tell us what is glaucoma?
Okay. Glaucoma is, I'm going to keep it simple so it doesn't get too complicated. Glaucoma is a multiple disease. It's not one disease. Okay. It's a group of diseases with complications like increased eye pressure, optic nerve damage, and field defects. Wow. So for you to be confirmed to have glaucoma, you got to have optic nerve damage, narrowing of the anterior chambers, increased pressure of the eyes, and field effects. And again, risk factors like being black is a risk factor to be black. Age is a risk factor. And a member of your family suffering from glaucoma is a risk factor. Now, glaucoma doesn't come from eating certain foods. No.
Okay.
You either have it in your family, or secondary issues of glaucoma could be Mike Tyson punching your eyes.
Really?
If you get an eye injury or certain diseases, systemic disorders, it could trigger glaucoma. So traumas can be part of it. And
So,
just for your knowledge,
no, finish
just
that.
for your knowledge,
Yeah.
children can have glaucoma. We have congenital glaucomas.
Okay. So, for instance, you mentioned earlier on about this glaucoma very prevalent among the blacks. And you said one of the causes could be an injury to the eye or an injury to the... So what do you say to African parents who slap their children, conk their children, bang their children? Is that a potential of that child having that problem?
You see, the head structure is interesting. When somebody slaps here,
Yeah.
Okay, you've got the eye socket there and the orbital fat and all that.
Yeah.
So a slap can just do all sorts of damage. Now, when I was sketching, I mentioned retina. Okay, the retina is somewhere there, which is the photographic plate of your eye.
Yeah.
A slap, a big slap, because I know the African slap is not gentle at all.
It's across the...
So the slap can cause retinal detachment even.
Really?
Good. The slap can trigger cataracts. Okay?
Wow.
This slap can cause all sorts of damage to the eye structure. So it's not just about, basic problems. It could lead to major hemorrhages in the eyes, which can even lead to the eye being removed, depending on how the degree of impact is.
Seriously?
Yes. It can force the eye to become cross-eyed. Do you know that?
Please,
because
parents,
the muscles in the eye are all interconnected.
please,
So slap is bad.
please, parents, I'm not against disciplining your children. Even the Bible said you should discipline your child. But please, there are other ways to discipline a child before you put that child into a permanent damaged position just because
Correct.
just because you're upset, just because they didn't bring your slippers on time. Please, let us remember that these children, they're just human beings in small bodies. And anything that like the doctor was just saying now, a heavy slap, a big push against the wall, and all of that could leave those children in a state of permanent damage. So please, let's be careful, let's be mindful. God will help us. Please go ahead, ma'am.
Yes. So glaucoma is where we need to campaign, whether in churches, whether in our schools, and say we need to take it more serious. We've had many people go blind, and sometimes they say, oh, somebody attacked. Nobody attacked you. Just come, let's test you first. And then when we deal with that aspect, then we can deal with the spiritual later. Or we deal with the spiritual same time but by not checking your eyes on time, you're leaving yourself at risk. Like I said, glaucoma is a major cause of blindness. Okay? Another cause of blindness is diabetes.
Okay.
We have diabetic eye diseases. Okay? Now, flagging back a little bit. When you come to see me in practice and I look into your eyes, like I said, the eyes is the window of the body.
Right.
I use equipments like ophthalmoscopes. I use equipments like Volclens. These are lenses that I look into your eyes with the help of light, and I can investigate the back of your eyes. Now, when I look into your eyes, I'm looking from the cornea, from the external. So just looking at your eyelid, I can pick up that you've got a cancer or you're diabetic. I can pick up that you've got infections, viral infection, bacterial infections. I can pick up that you've got diabetes, blood pressure problem, just by looking. And when I get in, I can find out that you've got arthritis, maybe rheumatoid arthritis, just by looking. I can find out that you've got
in your eyes.
Pardon, sir?
All of that just by looking in the eyes.
Yes, I've not really gone internally. I'm just saying from even the external, which is the external includes your eyelid, your aqueous chambers, your lens, and the ciliary muscles and all that. So that's your externals. Then when I hit the lens capsule itself, you know, when I drew that, this ball here, the lens capsule itself, you hear people talking about cataracts.
Yeah.
Cataract is the aging of the eye, the aging of the lens structure itself.
Okay.
So everybody, including dogs, have lenses. And the lens is one thing that grows throughout life. So when you get older, or even as a child, you've got congenital cataract, which is the hardening of the lens capsule. So when your lens is hardened, in old age, they say, oh, I have haziness. I notice haziness. Mm-hmm. Things are appearing milky and cloudy.
Yeah.
In certain parts of Africa that I wouldn't mention, they do what they call couching, where they knock it in. They go to the village and knock it in. They're making you blind.
They knock the eye in.
They knock the cataract lens in. And it goes to go into the vitreous and causes more complications. Jeez. And they do what they call needling. These are dangerous practices that we as Africans have been involved with in the past. But just to sound a warning, if you have a baby and you notice the eyes are milky in color, please go and see your GP, because cataract can double as retinoblastoma. It looks like red cancer. Retinoblastoma is an eye cancer, so you need to visit the GP, especially if you notice milkiness of your baby's eyes. I just need to remind us that. Cataracts, you have congenital cataracts and you have senile cataract. There are different types. It's up to the optometrist to explain to you what kind of cataract you have. And cataract could come from diabetics. Cataract could come from just eating the wrong food.
Oh, we're going to do with food next week.
Yes, too much fufu. You know? And a lot of degenerative changes can lead to cataract. Again, cataract can be due to trauma as well. Okay? Now, somebody who uses steroids a lot, especially in Africa where we self-medicate. So I have an inflammation, I go and buy prednisolone. You are predisposing yourself to either glaucoma or cataract. So stop it. It might help you for now. Prednisolone is steroidal, and people use it for, you know, reducing inflammation, but you're making yourself prone to glaucoma, cataract, and certain bone degenerative changes. So that's for cataract. So when you have cataract, it comes in degrees. There are different levels. It starts a little bit, it reduces the ability to see, and then it gets worse. And when it gets very worse, when you come to see an optometrist or an ophthalmologist, as the case may be, we get, as an optometrist in the UK, we refer you to have what they call phacoemulsification, which is removing of the lens, hardened lens capsule, and replacing it with intraocular lens implant, which is placing a new lens from where it was replaced. We place the lens in a capsular bag, and this capsular bag would hold that lens and you can see brilliant. And when 6 weeks passes, we'll see you and give you reading glasses in most cases, depending on your prescription. But guess what? Post-cataract, you can develop what they call secondary opacifications. So we refer you again for them to laser you. But for as long as you have the handling of the lens capsule, if you don't get it removed, you won't be able to see. And if you're a UK driver, you may lose your license. Okay? And that jumps me to another aging problem that is common, especially in the UK, is age-related macular degeneration. Now, this is on the retina itself. The most sensitive part of your retina is the fovea centralis, which is where all the light focuses on and you can see effectively. And the fovea or the macula, you can see colors, you can see white light and all that. But if for any reason there is formation of protein deposits called drusins on your macula, it denies you the ability to see color, light, and dark. So and there are two types of macular degeneration. You have dry macular degeneration and wet macular degeneration. The dry one is end of day. End of day means the eye is finished. It doesn't finish straight away, by the way. It's a gradual process. So it's important for you, if you've never been for an eye test and say, no, I'm fine, I can see for miles, and suddenly you see straight lines, wavy lines, you're developing a macular problem. So don't fast it away. Please come quickly to your optometrist and let them help you. And we can investigate it and see whether it's something we can correct. I'm going to flag through certain symptoms. You might sometimes be watching television and it looks as if there's fluorescent NEPA has taken life. NEPA is in Nigerian Electric Power Authority.
National Electric Power Authority. Or never expect power, always.
Always. So you might be watching your television and sudden loss of vision. That's not a good news at all. You might need to immediately report to A&E or come to your optometrist the next day if you can still see, because it could be life-threatening. You could be having what they call central retinal vein occlusion, and if it's central retinal vein occlusion, your blood pressure could be at risk. And that's, I'm going to get to that. Or if it's central retinal occlusion, artery occlusion, it could lead to fatal death. So we don't want things like that. Sudden loss of visions. Okay? Now, I'm trying to make it as simple as possible. But when you come to the opticians, we do not see you to sell you glasses. We don't sell glasses. I don't sell glasses. I'm a clinician. When you come to see me, I want to look at your health. The health of your eyes is the health of your body. So if I look into your retina and I notice there's blood in the retina, I will do an emergency referral. It depends on the extent of bleeding that I notice. It could be that you develop diabetes, or you could be having vein occlusion, a blockage of your vein. Now, in the retina itself, I'll try and see if I can catch a photograph. In the retina itself, you have the arteries, the veins, and you have the capillaries and all that. So when you have things like central retinal vein occlusion, I'm just trying to see if I can get. If you have central retinal vein occlusion, something like that. Now, this is a patient who came to see us, for instance, and he said, I just noticed I couldn't see properly. When I looked into the eyes, what did you see? Blood.
Blood.
Now, this is an emergency.
Wow.
This is an emergency. So this is not, oh, we'll see you next week. We'll see you now. So this is an emergency, and for you as a patient, you can't see, okay? Because your eyes are, having problem. And if it's somebody who has, because I did mention wet I mentioned age-related macular degeneration, that a patient could have that because these are basic problems that we have. I'm just going to pick up macula. Sorry about this.
While you're doing that, can I just say something?
Yeah, go on.
Ladies and gentlemen, I am so grateful for what we are getting on this program, especially this month. Last week we dealt with mental health. Today we're looking at the issue to do with our eyes. And I don't know about you, some of the things I'm hearing, I'm scared, I'm concerned, I'm worried that a lot of us are dying in silence. A lot of us are dying and not even knowing it. We are killing ourselves. Doctor just mentioned now that by looking into your eyes, they can see if you have cancer, if you have diabetes, if you have high blood pressure, if you are going blind. I mean, if that alone, for the cost of one Burger King, you could go in tomorrow and have your eyes checked. A lot of people say, I don't want to go to the doctor just in case they tell me bad news. What would you rather have? Know what is wrong with you now, or sleep tomorrow and not wake up and put the whole family in trouble? For the cost of an eye test, doctor, you said something just now, that the opticians are not there just to sell glasses.
No way.
Can I tell you the truth? For up till when you mention it, the mindset of a lot of people, including myself, is that every time you go for your eye checkup, why is it that they never say, oh, your eyes is better now, you don't need your glasses? They prescribe something. They're just selling glasses. But to hear what you are saying now,
I will show you a
if you
patient
think education is expensive, try ignorance. Because lack of knowledge, lack of understanding is what is making a lot of us get into trouble. Because anyway, doctor, don't let me steal into your time, because we've got a few more minutes.
Okay, I'm going to show you a picture.
Okay.
Can you see that picture?
Yeah.
Good.
Please go.
That picture was a patient I saw. I saw the patient. She just came in for, oh, my eyes, I can't see properly. Okay, she couldn't see properly. That patient. See that?
Yeah.
And she hasn't had her last sight test was 10 years ago. And I performed a scan. That's a scan result. And there's fluid in her eye. And as at the time I tested her, she was in clinic today again. She's not seeing out of that eye. Her last sight test was 10 years ago. There's some people, I've met a patient who her last sight test was 50 years ago. She was 78 when I saw her. By the time I had seen her, she was blind because she was bumping into things. Okay? I had a patient when I had my practice. She came in to see me and she was forced in to see me. And when I saw her, her friend said she doesn't want to go to hospital. We had to call an ambulance to take her to hospital. I can't say it enough. Your eyes is your life. Your eyes is your life. If you don't look after it now, you can't look after it when you're gone. So every time you step into the optician's practice to see, I'm not trying to trigger fear, but I'm trying to say, let's become, precautious, aware. Yeah. Let's become aware. Because when we look into your eyes, we can see the arteries, the veins, and if they are not looking healthy, we can pick up that, wow, you've got blood pressure. Say, no, but I haven't got blood pressure. I can see you have. I can see you've got hyperlipidemia. I can see you've got hypercholesteremia, which is high cholesterols. I can see it. And we can do something early. They say a stitch in time saves 20, not 9.
Not
A
nine.
stitch
Saves
in time,
everything.
yes. It
Can
saves
I
a lifetime. Yes,
can
sir.
I ask a question, man?
Yes, sir.
Sometimes I feel physical pain in my eyeballs. I will then wash it with cold water, and after a while, it will go down. But it is just maybe once in 4 or 5 months, I'll just feel it, and I can feel that it's not a facial pain, but it's right in my eyeballs itself.
Okay.
I know I'm not asking you to diagnose me now, but I'm saying something like that calls for immediate attention, obviously, for you to at
Oh,
least
definitely, yes.
go and see your GP. Now, in this day and age where we all sit in front of computers or our iPads or our phone or this or that, there's so much light going in our eyes. Is there any damage that could cause, either short term or long term?
Now, the way I will answer this question is how I will speak to you as my patient if you came to me and made that complaint, right?
Okay.
One of the things we've noticed that kids, adults, they are either on the iPad or on their phone. They sleep with it and they wake with it. There's visual stress linked with computer. It's been researched. It's been found that there are visual stress associated with the use of VDUs, that's visual display units.
Units, yeah.
So to help yourself, give yourself short breaks in between. I'm not going to tell you to stop work because some people are dependent on it.
Yeah.
But try and take breaks in between. Using cold water is good, but you can use things like there are masks now built you can put in the fridge and put in your eyes to rest your eyes.
Okay.
But under no circumstance should you wash your eyes with eye buds.
What's that?
Under no circumstance. The reason I say that is I've had patients come to me and say, I wash my eye with, I won't mention so I don't get sued for mentioning people's. So they wash their eyes with certain eye buds. No. Stick to advice from a qualified practitioner. Their eye drops will give, their eye mask will give, and all sorts of treatment will give. You can massage your eyes. That's acceptable. Gentle massage. Don't use muzzle. You can gently massage your eyes. Okay? And you can do things, but if you feel still unresolved, see your optometrist. I personally said, I'm not saying don't go to your GP, but most GPs are not eye trained. So if you go to a GP, they're going to come back to us and say, go and see your optometrist. So in that case, you'd go and see your optometrist. And I'm not advertising for any company, but certain companies have free eye tests on their websites. So if you Google to any of the eye companies, you will get free eye tests if the issue is, oh, it's too expensive. But like my brother said, you can never pay too much for your eyes. And these days, certain companies also, where we consult, they use eye scans now. So you can pay a £10 or sometimes free of charge just to get your eye scan. This was an outcome of a scan. It's not a normal standard test. But if somebody had to pay £10 to get this found out, I think it's not too much to pay.
Not at all.
Yes.
Not
So
at all.
it's about caring for your eyes. This being passionate is because your eyes will see us till the end. Our eyes is one thing that will live with us, till the end. But really, it's not really about glasses. Because if I tested your eyes and you need glasses and I found out you have more dangerous thing going on or more, something else, I will not prescribe glasses. I will treat that first before I recommend glasses. But my passion is really for children, and and you are what you eat and you're what you look at. So for your children, those who think kids should not be tested until they become 16. You're making a big mistake. Just go there. Kids are free of charge, by the way.
Exactly. I was about to say, but children are even free. All it will cost
Test
is
in
an hour
England
to
for
sit in the.
children is free of charge. Free glasses, free of charge. So don't think of how much you're going to pay. We are passionate about saving the sight of children. We are passionate about looking after your children's eyes. So if you go there and somebody is charging you, go somewhere else. There's somewhere they're charging free of charge. So don't say because there's no money. No. In some companies, they give 2 pairs of glasses if your children need it. So you're not going to be out of pocket at all for kids.
Can I ask you one question? I've got some questions here, but I'm conscious of our time, but we might just take 10 minutes extra today. Let me ask you this question.
Yes, sir.
How is laser eye surgery I've had laser eye surgery recommended to say, oh, instead of wearing glasses, just go and do laser eye surgery and you'll be fine. What's your take on that?
My personal take. Number one, I'm an optometrist, so I give glasses and contact lenses. We don't, I mean, in the practice where I run, we don't do laser. But my personal take, before you have laser done, do your research very well. I personally will not go to anywhere they say buy one, get one free. And I'll explain.
For laser
surgery. When you're having laser done, it's a risk, high risk. Okay? The cornea is removed. They have different techniques. And you sign a document saying if it goes wrong, it's on you. If it goes well, it's on you. And I could be an eagle, but this one I choose to be a chicken. So I don't like invasive processes that I'm not in charge of. So I will research very well first. Make sure you check the license of the person doing your surgery, so you don't get the wrong person, a butcher your eyes, because there are a few out there. So you need to check well. Sorry, sir?
All they will say is sorry.
Yes. So you got to research properly, and then sometimes people tell you go to that one. No, research very well, because not every eye is eligible for laser management.
Oh.
Yes. If you have certain irregular astigmatism, they will not do it. So don't use your eye. Don't risk your eye. Maybe somebody said, no, other people said I can't do it, but I can do it. No. Research very well. We don't do LASIKs, but those who do it, research. I'm not allowed to recommend any practice or any, just because of the legalities of it. Yeah. But the best thing is do your research very well. Ask the right questions. It's your eye. So if you see a surgeon, ask anything, Google anything and ask them. And if they can't answer your question, don't put your eyes down, because the moment they zap you, your eye is gone. And they've got successful ones and they've got the bad ones too. So my take on it is do your research, and if it's for cosmetic reasons and your prescription is not like -15, just wear contact lenses. Because with contact lens and glasses, you're in control. You can take it out and put it back. But the things you're not in control, it becomes a risk.
Okay, let me ask you another question quickly.
Yes, sir.
You've been to your optician. They've done what they have to do. They've checked and everything. One of the things I have experienced, I've noticed, is that people are, I don't know if it's fear or whatever, they are reluctant to ask questions from the opticians about, so what did you see? And even opticians are reluctant to say to somebody, I think you've got high blood pressure, you need to do something about it. Why is that? Why is that limitations in the conversation between an optician and the patient? Why is that?
I'll use myself as an instance. In my practice, for instance, I create an atmosphere between my patient and myself so that they are open to ask me questions. So depending on who you're dealing with, you've got like opticians and optometrists. We're humans.
Yeah.
So you have different kind of personalities. I'm an extrovert. So if somebody comes to me and I can start off with my icebreaker by having a laugh, they say, "Oh, how lovely your hair is." Somebody might not be able to do that. So when I break the ice and then we start the conversation, you'll be able to know who you're dealing with as a patient, whether they are the type of people that want to just have other discussions, or this person really just wants to test my eyes and go. So if it's that sort of person, you keep it very formal because you need to understand your environment, understand your patient as well. But for me, my patients ask me all sorts of questions, any sort of questions. And if I don't know the answer, I simply say, I don't know, and I will get other results. But generally, I think each optician or each optometrist differ.
Okay.
So different people differ from, you know, from what they can answer. Have some of the time, somebody may not know the answer either. So don't assume that the person knows. Somebody
Wow.
might not know why, and it becomes embarrassing when you ask an expected optometrist to give you the answer and he doesn't know it and he doesn't know how to tell you because he's also worried that it might affect your confidence. So they become defensive. So
No.
everybody is different. Everybody is different.
But you can ask your optician about what they've seen.
Oh no, you feel free. I personally, when I finish testing your eyes, I'll say, have you got any questions for me? That's my ending of my test. I ask that because sometimes it's quite daunting invading into somebody's eyes, looking into it, and then coming out and say you're fine. That's not fine enough. So I like to explain what I've done, the process, and then even when I put eye drop, before I put eye drops, I tell you what I want to do. After I put it, I give you a leaflet just to explain so you're not confused. Because sometimes people come by and say, I didn't know what you did. Even after you've explained, because it was too traumatic for them to go through it,
Yeah.
especially somebody who hasn't tested their eye for 10 years and suddenly you tell the person you've got diabetes or you got blood pressure. It's quite traumatic experience. So it's you
How
just love them gently.
how often should you test your eyes?
Nice question. I was waiting for that. Now, if a child came to see me, for instance, I saw a child today, okay? And this child was wearing a strong prescription and I haven't seen him before. I finished testing. I said, I'll see you in 3 months. The reason I did it because it was a special case.
Okay.
He's only 5 years old. He's wearing a +7. And I finished my own test. I reduced it, but I want to see him in 3 months because I want to see the adaptation level because he had other issues apart from
Okay.
his eyes.
Yeah.
Then some kids I will see in 6 months. But if you as a child do not wear glasses, I will see you between 12 months and 2 years. Now, if I jump to teenagers, I'll see them if they're wearing glasses 12 months to 18 months to 2 years. If you're glaucoma patient who is already under the hospital, I'll see you every 2 years. But if you're a glaucoma relative, saying that your father has glaucoma, your mother, your sister, your daughter, I'll see you every 12 months because you're classified to be at risk.
Okay.
If you're diabetic, I'll see you 12 monthly or even 2 years if you're under care of the hospital.
Okay.
So everything depends on if you're perfect, like the emetrope, I'll see them every 2 years. I don't want to be seeing perfect eyes all the time because unless, and I always have a clause, except vision deteriorates. So when your eyes change and become unwell, it changes the decision making.
Yeah.
And we always leave a loophole because things can change. The eyes can change as quickly as your hair grows gray. So it all depends on what we're dealing with.
Final question.
Okay.
you've been to the optician, they've checked your eyes, and they've prescribed a pair of glasses. And you're wearing the glasses, and it's made the correction. How long does it take before that glasses will need changing?
Again, there's no straightforward answer. It depends. I'll give you an instance. A patient came. I saw this patient a month ago. This is a classic one. I
Yeah.
saw the patient, or somebody saw the patient a month ago. A month later, he said, the glasses you gave me, it was okay when I started wearing it. But after 3 weeks, I noticed I can't see very well. I test the patient again. Guess what? The eyes have changed. I changed the glasses then. In 3 months, the eyes have changed again. Guess what? I would have to instruct a test by the GP. I said, can you go to the GP, please? You need your blood sugar checked.
Okay.
And 9 out of 10, blood sugar checked, the person is diabetic. So I don't really have a fix, say, come every 2 years or come every 6 months, depending on the patient's need. I might test you today and you get a new job and as an IT specialist, so you're beginning to need to use the computer more. That changes your visual need. Then I will have to see you early and readjust. Or you could be 38 and then you cross into 40. The long distance glasses can no longer serve. So I need to give you reading glasses.
You've crossed the line.
You've crossed over, so I need to give you reading glasses. So, but generally, it's between 3 months, depending on for kids, 12 months to 2 years. And if nothing is really happening, some people would give up to 3 years, really. So there's no definite.
The moment you start adjusting your glasses, you know it's due for.
You will know when the eyes change. You will know. And there's sensitive things I would announce that we should watch out for. If it doesn't matter who. Okay. One of the questions when you come in to see us, we ask you, do you notice any headaches? Do you notice any flashing lights? Do you notice any floating specks? Do you notice any double vision? These are problem spots. If you notice headaches, it could mean that you need glasses correcting or migraine dealt with, depending on the location of your headache or how long you've been having the headache. If you notice flashing lights and floating specks, it's possible you're developing retinal detachment, vitreous detachment, or any of such serious problems. If you notice things like curtain coming down, a black curtain, that's classic of retinal detachment. And if you notice sudden vision loss, that's straight emergency. So don't take anything for granted.
And don't just shake your head and
no. And sometimes the common problem we also have is allergies and dry eyes. Dry eyes, you see people rubbing their eyes. You have what they call Sjogren's syndromes and all that. There are eye drops that we can deal with. And then we have blepharitis, which is you have somebody wakes up, there's matting of their eyes like nyama nyama,
Yeah.
We can manage those. But not all blepharitis are just clean it. We can have what they call demodex, which is worms are growing on your eyelashes. You need to come and see us. And we can clean all that and deal with it. Dry eye is one of the commonest eye problems, or blocked tear duct. Somebody has a blocked tear duct and you notice, but I'm producing tears. No, that channel is blocked because there's an tear lake down here which pumps fluid in through there onto the puncta. If the puncta, which is the duct, is blocked, you're going to have plenty of tears, but it's not going anywhere. So we can deal with that as well. And when you have dry eyes and you have Fishing syndrome is when you're like picking and that, you're causing more damage. So don't assume that you can look after your eyes. There are people who are trained to do it. There are people who are really trained to do it. So there's so much about the eyes. I could spend a whole eternity talking about eyes because there's so much. And but it's not really all about glasses. Yes, it's not all about glasses.
Well, doctor, all I can say is don't go far because we're going to bring you back very soon because uh, tonight has just been a night of wonders, a night of education and information, a night of discovery. Uh, I don't know about you, ladies and gentlemen, that are watching this program. I have learned a lot, and I have not just learned for head knowledge. I have learned to be more attentive, to pay more attention to things around me, especially to do with my health. And I want to believe that you feel the same way too. Dr. Wadi, thank you so much. It's just like, how does 1 hour just come and go like we've just been talking for 20 minutes? There is so much that we can still talk about and we need to talk about. So don't go too far. We're going to bring you back onto this platform for us to dig deeper. On behalf of everybody that has been part of tonight's program and those who will watch it later, we want to appreciate you. We want to thank you for your time, for the effort you've put into this, for the enlightenment, for the encouragement, and for a little bit of fear that you've injected into all of us because now... No, but seriously, there are things we've taken for granted, we've not paid attention to find out that cancer, diabetes, arthritis, and all of that can be this. No, please, ladies and gentlemen, for 20 pounds, I don't know how much they charge for eye tests these days. For the cost of 20 pounds, go and check your eyes. If nothing else, get a clean bill of health that your eyes are okay. And if they are not okay, then at least you know what you're dealing with, rather than trying to self-medicate, like doctor said. Ma'am, what a night. Thank you so much. We appreciate you. We honor you. We are forever indebted to the knowledge you've imparted to us tonight. And keep your phone on because we'll be bringing you back very soon because I believe there's so much we can cover and we still need to cover on this. Thank you. Well, ladies and gentlemen, this month has been a wonderful month on this platform. We've learned a lot and we're still learning. Next week, we're having another session with another special guest. And this time we're going to be looking at the food that we eat. The food that we eat. You are a product of what you put on the inside of yourself. So we're going to be looking at the food that we eat, how we do them, and this and that. And also we're going to be looking at physical exercise. Especially for some of us whose middle kingdom is growing, we need to pay attention and find out how to deal with it and stay healthy. Stay healthy for goodness sake. If not for yourself, do it for your family. And remember, we have a destination. We are going somewhere. We have a purpose and we must deliver on that purpose on this here on earth in our lifetime. So this journey that we've been on is a journey of discovery. It's a journey that is taking us towards that final destination. But I know for definite, after tonight, we've just added a new feather to our wings so that we can fly higher and fly further and get closer to our destination. Because when we arrive at that place, when we arrive at our final destination, everybody will have no choice but to say, surely these are better men and better women. Thank you for your time. I'll see you again next week. Tell somebody about it. If you have not shared tonight's program, please go and share it and let's show our appreciation and our love for Dr. Chibuzo Wadi. It's been an honor. Thank you so much, ma'am.
Thank you.
And God bless you. Have a great week.
God bless you too.
Bye-bye now.
Thank you. Bye-bye. Bye.